Okay, so whenever you see a patient in which the PPI, permanent pacemaker, is implanted, and this patient comes again with dizziness or hypotension or feeling uneasiness, or even if it comes normal and you get to see an X-ray of this patient in which the PPI is there, permanent pacemaker is there, always try to look at the pacemaker, the leads position, because three syndromes you need to identify, you need to always look for. The one is the Twiddler syndrome, second is the Reel syndrome, and the third is the Ratchet syndrome. So I'll try to explain you with a graphical presentation. You can see the x-rays by going googling online. So you see that this is a normal, I would say this is a normal pacemaker, and these both leads are going to the right ventricle. So both leads are going to right ventricle. Now in this Twiddler's and Reel syndrome, what happens, it rotates the pacemaker, this pacemaker portion rotates. So one rotates on the long axis and the other rotates in the short axis. So to remember Twiddler, it twists, so it rotates on the long axis. So what happens, these leads are twisted around, so ultimately they will break and they will cause symptoms, and the treatment is we need to replace the pacemaker, remove these leads like that. Now in the Reel syndrome, what happens, it rotates around the short axis like this. So it coils around the leads, coils around the pacemaker. So if it is not causing symptom, or if it is not causing fractured legs, then this can be repositioned in the pocket. Usually it is removing is not required. This usually happens within the first month of PPI implantation, and this Twiddler ones usually occurs over 1 year, usually in the women, obese, or somewhere the pocket is loose like that. One more thing you need to remember is Ratchet syndrome. In what happened, Ratchet, it pulls back. Here this pacemaker is not getting rotated, but what is happening, because the movement or loose pocket or something like that, these leads gets retracted from here, so they lose their point where they needs to be inserted, and they cause syndrome. So then this pocket needs to be reviewed and like that. So it Ratchet means retracted backwards. So whenever you see a pacemaker x-ray, patient with a pacemaker, always try to identify the pacemaker and trace the leads. I hope this helps. Do read more about it. Thank you.